Question: how is adrenal rupture managed surgically? Answer: adrenal rupture is managed surgically by controlling bleeding, repairing the adrenal gland if feasible, and addressing any associated injuries. Question: what is the role of angiographic embolization in managing adrenal injury? Answer: angiographic embolization involves blocking the blood vessels that supply the injured adrenal gland, reducing bleeding and preserving adrenal function. Question: how can the risk of infection be minimized in adrenal injury management? Answer: administering antibiotics, practicing meticulous surgical technique, maintaining sterile conditions, and effective wound care help minimize the risk of infection in adrenal injury management. Question: what is the role of hormonal replacement therapy in managing adrenal injury? Answer: hormonal replacement therapy, particularly glucocorticoid and mineralocorticoid replacement, is necessary in cases of adrenal injury causing adrenal insufficiency. Question: how can the risk of adrenal insufficiency be managed after adrenal injury? Answer: timely hormone replacement therapy, monitoring adrenal function, and patient education about recognizing and managing adrenal crises help manage the risk of adrenal insufficiency. Question: what is the significance of adrenal hematoma in adrenal injury? Answer: adrenal hematoma can occur due to bleeding within the adrenal gland. If it enlarges or causes symptoms, intervention may be necessary. Question: how can the risk of adrenal crisis be managed after adrenal injury? Answer: educating the patient about adrenal insufficiency signs, providing an emergency card with medication information, and ensuring regular follow-up help manage the risk of adrenal crisis. Question: what is the role of imaging-guided drainage in managing adrenal injury? Answer: imaging-guided drainage can be used to drain large adrenal hematomas or abscesses, reducing pressure and promoting healing. Question: how can the risk of post-operative bleeding be managed after surgical repair of adrenal injury? Answer: adequate hemostasis, meticulous surgical technique, and proper wound closure help manage the risk of post-operative bleeding after surgical repair of adrenal injury. Question: what is the role of corticosteroid therapy in managing adrenal injury? Answer: corticosteroid therapy may be used to reduce inflammation and swelling in cases of minor adrenal injury or hematoma without significant adrenal dysfunction. Question: how can the risk of adrenal abscess formation be managed after adrenal injury? Answer: regular surveillance and interventions such as drainage and antibiotics help manage adrenal abscess formation that may develop after injury. Question: what is the significance of adrenal cyst formation in adrenal injury? Answer: adrenal cysts can develop as a result of hemorrhage or infection in adrenal injuries. Monitoring and interventions are necessary if they cause symptoms or complications. Question: how can the risk of adrenal gland necrosis be managed after adrenal injury? Answer: timely surgical intervention, minimizing ischemia time, and ensuring adequate blood supply help manage the risk of adrenal gland necrosis during repair. Question: what is the significance of adrenal gland dysfunction and delayed complications of adrenal injury? Answer: adrenal gland dysfunction can lead to hormonal imbalances, electrolyte disturbances, and cardiovascular instability. Monitoring and interventions are important. Question: how can the risk of post-operative infection be managed after surgical repair of adrenal injury? Answer: administering antibiotics, maintaining proper wound care, and addressing any signs of infection promptly help manage the risk of post-operative infection after surgical repair. Question: what is the role of laparoscopic approaches in managing adrenal injury? Answer: laparoscopic approaches may be used for surgical exploration and repair of adrenal injuries, providing minimally invasive options for selected cases. Question: how can the risk of adrenal vein thrombosis be managed after adrenal injury? Answer: regular surveillance and interventions such as anticoagulation therapy help manage adrenal vein thrombosis that may develop after injury. Question: what is the significance of adrenal pseudocyst in adrenal injury? Answer: adrenal pseudocyst, a fluid-filled cavity, can develop as a complication of adrenal injury. Monitoring and interventions are necessary if it causes symptoms or complications. Question: how can the risk of delayed adrenal hemorrhage be managed after adrenal injury repair? Answer: regular surveillance and interventions such as imaging studies and embolization help manage the risk of delayed adrenal hemorrhage that may develop after injury repair. Question: what is the role of hormonal suppression therapy in managing adrenal injury? Answer: hormonal suppression therapy may be used to manage minor adrenal injuries and reduce the risk of adrenal dysfunction or hematoma enlargement. Question: how can the risk of adrenal atrophy be managed after adrenal injury? Answer: regular surveillance and interventions such as hormone replacement therapy help manage adrenal atrophy that may develop after injury. Question: what is the significance of delayed adrenal gland enlargement in adrenal injury? Answer: delayed adrenal gland enlargement can result from hematoma organization or abscess formation. Monitoring and interventions are important if it causes symptoms. Question: how can the risk of adrenocortical carcinoma be managed after adrenal injury? Answer: regular surveillance, imaging studies, and appropriate interventions help manage the risk of adrenocortical carcinoma that may develop after adrenal injury. Question: what is the role of adrenal gland biopsy in managing adrenal injury? Answer: adrenal gland biopsy may be considered to assess for malignancy or infection in cases of adrenal injury with suspicious features. Question: how can the risk of adrenal gland calcification be managed after adrenal injury? Answer: regular surveillance and interventions as needed help manage adrenal gland calcification that may develop after injury. Question: what is the significance of adrenal hemorrhagic infarction in adrenal injury? Answer: adrenal hemorrhagic infarction, a rare complication, can develop due to thrombosis or vascular compromise. Monitoring and interventions are important if it occurs. Question: how can the risk of adrenal vein injury be managed during surgical exploration? Answer: careful dissection, hemostasis techniques, and expertise in adrenal anatomy help manage the risk of adrenal vein injury during surgical exploration. Question: what is the role of laparotomy in managing severe adrenal injury? Answer: laparotomy may be indicated in severe adrenal injuries with ongoing bleeding, extensive damage, or associated injuries requiring exploration. Question: how can the risk of postoperative adrenal insufficiency be managed after surgical repair of adrenal injury? Answer: providing appropriate hormone replacement therapy, monitoring adrenal function, and patient education about adrenal insufficiency help manage the risk after surgery. Question: what is the significance of adrenal artery pseudoaneurysm in adrenal injury? Answer: adrenal artery pseudoaneurysm can develop due to arterial injury or rupture. Timely intervention is necessary to prevent complications such as rupture. Question: how can the risk of adrenal artery injury be managed during surgical exploration? Answer: identifying and carefully dissecting adrenal arteries, ensuring hemostasis, and having vascular surgical expertise help manage the risk of adrenal artery injury. Question: what is the role of adrenal vein ligation in managing adrenal injury? Answer: adrenal vein ligation may be used to control bleeding from the adrenal vein during surgical repair of adrenal injury. Question: how can the risk of postoperative hematoma be managed after surgical repair of adrenal injury? Answer: adequate hemostasis, meticulous surgical technique, and proper wound closure help manage the risk of postoperative hematoma after surgical repair. Question: how can the risk of adrenal artery pseudoaneurysm rupture be managed? Answer: immediate intervention, embolization, or surgical repair are necessary to manage the risk of adrenal artery pseudoaneurysm rupture. Question: what is the role of postoperative imaging studies in evaluating adrenal injury repair? Answer: postoperative imaging studies such as CT scans or ultrasound help assess healing, identify complications, and guide further management. Question: how can the risk of adrenal vein thrombosis be managed after adrenal injury repair? Answer: regular surveillance and interventions such as anticoagulation therapy help manage adrenal vein thrombosis that may develop after injury repair. Question: what is the role of imaging-guided biopsy in managing adrenal injury? Answer: imaging-guided biopsy may be considered in cases of suspected adrenal malignancy or infection, helping guide appropriate management. Question: how can the risk of adrenocortical insufficiency be managed after adrenal injury? Answer: hormonal replacement therapy, monitoring adrenal function, and patient education help manage the risk of adrenocortical insufficiency after adrenal injury. Question: what is the significance of adrenal hemorrhagic shock in adrenal injury? Answer: adrenal hemorrhagic shock can occur due to massive bleeding from adrenal injury. Urgent intervention, resuscitation, and control of bleeding are essential. Question: what is the significance of delayed adrenal gland dysfunction in adrenal injury? Answer: delayed adrenal gland dysfunction can occur due to hormonal imbalances. Monitoring and interventions are important if it develops after injury. Question: how can the risk of chronic pain be managed after adrenal injury? Answer: addressing pain management, identifying underlying causes, and offering supportive therapies help manage the risk of chronic pain after adrenal injury. Question: what are the common causes of adrenal injury? Answer: adrenal injury can result from blunt trauma, motor vehicle accidents, falls, sports-related injuries, and other trauma to the abdomen or back. Question: how is adrenal injury severity assessed? Answer: adrenal injury severity is often assessed based on clinical presentation, physical examination findings, and imaging studies such as contrast-enhanced computed tomography (CT) scans. Question: what are the clinical signs and symptoms of adrenal injury? Answer: clinical signs of adrenal injury may include abdominal or back pain, flank tenderness, bruising, hematuria, blood in urine, and signs of adrenal insufficiency. Question: how can adrenal hemorrhage be differentiated from other adrenal injuries? Answer: adrenal hemorrhage often presents with acute abdominal or back pain, hypotension, and signs of adrenal insufficiency. It can be distinguished from other adrenal injuries through imaging studies. Question: what imaging studies are commonly used to diagnose adrenal injury? Answer: contrast-enhanced computed tomography (CT) scans are the primary imaging modality used to diagnose adrenal injury, assess the extent of damage, and rule out associated injuries. Question: what is the initial management approach for a patient with suspected adrenal injury? Answer: the initial management approach includes stabilizing the patient, assessing for signs of adrenal insufficiency, and diagnostic evaluation with imaging studies. Question: what is the primary concern in managing adrenal injury? Answer: the primary concern in managing adrenal injury is preventing adrenal insufficiency, controlling bleeding, and minimizing the risk of subsequent complications. Question: how does the management approach differ between minor and severe adrenal injuries? Answer: minor adrenal injuries may be managed conservatively with close observation and pain control. Severe injuries with significant hemorrhage or functional impairment may require surgical intervention. Question: what are the indications for surgical exploration in adrenal injury? Answer: indications for surgical exploration in adrenal injury include ongoing bleeding, hemodynamic instability, suspected adrenal rupture, and associated injuries requiring surgical intervention.